basically, call it the stupidity of the American voter or whatever.
Too stupid to understand.
It's a very clever, basic exploitation of the lack of economic understanding of the American voter.
We have to pass the bill so that you can find out what is in it.
A new web video from the Republican National Committee pouncing on comments from MIT professor Jonathan Gruber as the new GOP majority prepares its plan of attack against Obamacare. And we're back now with the panel. So Professor Gruber, who helped first write Romney Care and then with Obamacare, says that the president's plan was written deceptively on purpose to get it through Congress. He says that they hid the fact that the mandates were really taxes. He said they hid the fact that the whole plan was a massive transfer of wealth. George, what does this tell you about Obamacare, and what does it tell you about the people who wrote it?
Well, it tells us that they were consciously deceptive. We knew that at the time. It tells us that they did lots of unseemly things to get it past the Cornhusker kickback and the Louisiana Purchase and all the other log rolling that went on. But beyond that, Mr. Gruber has been insulting the American people, and that's not wise. But what he has really said that people haven't focused on sufficiently yet is that they deliberately wrote the law clearly to say that subsidies could be dispersed only through exchanges established by the states. Why does this matter? 225 days from now is the last Monday in June. By then, the Supreme Court will have ruled on whether Mr. Gruber's telling the truth, whether that is really what the law says. If it does, and if Republicans can have the patience of politics and wait for the Supreme Court to rule, they will find that the president can no longer administer the Affordable Care Act, and he will come to them hat in hand, and they will have all the leverage to negotiate changes in the Affordable Care Act.
Because the point is, and I'm not exactly sure, maybe you are, what, about 15 of the states have exchanges, the other 35, and it's off by 1 or 2.
And
have federal exchanges, and according to the law, if it's a federal exchange, they don't get the subsidies.
And the wonderfully loquacious Professor Gruber has said clearly, we wrote it that way to squeeze the states.
All right, from the White House on down, Democrats are doing everything they can to distance themselves. You say Mr. Gruber, I prefer to say Professor Gruber. Take a look at the Democratic leader in the House, Nancy Pelosi, now and back in 2009.
I don't know who he is. He didn't help write our bill.
I don't know if you have seen Jonathan Gruber of MIT's analysis of what the comparison is to the status quo.
One, aren't these gyrations by Democrats to distance themselves from Professor Gruber a little embarrassing?
Yeah, that looked bad. That's a gaffe, I would say. And, and I like the tape you played earlier where she said, you're going to have to pass this law to see what's in it. So, that doesn't help. But, I mean, I think Gruber was insulting to the American people and arrogant in his attitude. So there's a lot of hubris involved here, and I think it's a feast for critics of Obamacare who suddenly are saying, oh, this is why we are upset. Look, are you kidding me? In Washington, we package, we merchandise just like, Procter & Gamble and anybody else that's selling soap. Of course, things are packaged in such a way as to promote
So there's nothing new here, nothing that Gruber's...
There's very little. In fact, I would say there's much ado about nothing with Gruber, except that the critics of Obamacare are having a field day. The act is working. The uninsured rate in the country's dropped by 25%. This is something that Republicans should be celebrating. We have more competition. We've done away with the Medicare donut hole. We have no lifetime caps and limits. We have no conditions about pre-existing illnesses. We have preventative medicine. It's just incredible to me, though, Republicans persist.
So, Britt, 2 questions. One, there's a feast here to answer Brother Williams. One, is it much ado about nothing, the whole Gruber affair? And secondly, and more importantly, how much effect does it really have in the efforts of Republicans to try to, if not repeal, take a scalpel to Obamacare?
And answer your first question, what Juan says is so, but it's not quite applicable. Yes, legislation is always argued for in the way that it's most advantageous to those who are promoting it. And it is sold, and there are exaggerations and so forth. What we have here is something quite different. We have an admission of an all-out effort to deceive on a number of points based upon the notion, common, I'm afraid, among many liberals, that the American people do not know what's good for them, and they need their more intelligent betters in the professoriate and other locations to take care of that for them. That is a kind of a premise of Obamacare. As a practical matter, I think it furthers the case that people have a sense, I should say, that people have that they were sold a bill of goods on this. And when we talk about the people who now have insurance who didn't, great numbers of those people are on Medicaid. Medicaid patients are having a terrible time finding a doctor who will see them. And there's more coming out about this all the time, about this, the medical facilities being strained, Medicaid reimbursements are light, doctors don't want to treat them. So having the insurance is one thing. The question is, do they have care? And I think that question is, in many cases, the answer is no.
Just to pick up on the other point, how important will Gruber's comments be as a weapon for Republicans to go after Obama?
Well, it'll be a gift that keeps on giving as they attempt to chip away at Obamacare. But as George has suggested, the whole thing may collapse if the Supreme Court rules that the language of the law on whether non-state sponsored exchanges can will allow people in those states. I'm sorry.
We'll give subsidies.
We'll get subsidies. If that happens, the whole thing goes. I think the whole law begins to implode on itself.
If I could just pick up on that. I think with Gruber, though, if they have a hearing, they'll haul him in front of Congress, they'll yell at him. It kind of just reconfirms people who are already skeptical of Obamacare. It kind of reconfirms their suspicions. I would agree the Supreme Court case would be a way that's going to chip away. I also think the medical device tax repeal, which has bipartisan support. You talk to Democrats who don't really like that. That's another $29 billion that would be removed from the Affordable Care Act.
You may not like the medical device tax, but then where do you get the $29 billion over the course of a decade?
And that is the question.
All right, let me ask you another question while I'm at it. Open enrollment for the second year of Obamacare started actually yesterday, amid reports that some of the policies that people bought this last year are going to cost, same policy, 20% more this coming year. From people you talk to, Jackie, how confident is the administration that Obamacare is going to do, and it couldn't do much worse, is going to do better in its second year than it did in its first?
What you're hearing is from some of the people that where their plans have gone up. Officials are telling them to shop around. There's going to be another cheaper plan, to go back and buy something else that might be a little cheaper, and saying that it'll level out in the next 2 or so years, and that you won't see those plans, the prices raise again. But whether it does or not, I mean, we'll have to wait and see. But every time that happens, when your health care goes up again, it erodes the confidence, and that's what they're going to be dealing with.
George, we've got less than a minute left. I'm going to ask you a big picture with a short answer. What happens to Obamacare? Do you think that the basic entitlement, I'm not talking about the one tax or something, do you think the basic entitlement lasts or not?
I think that if the basic entitlement is that everyone in America ought to have insurance coverage, I think that is now part of the ethic of the country, but there's so many other and better ways to achieve that. The fact is, what Gruber does is strike at the legitimacy of the law. The defense of Obamacare has always come down to, it's the law, get over it, live with it. Yes, but what Gruber says is, we didn't do it in a legitimate way.
All right. Thank you, panel. See you next Sunday.